My name is Dr. Premal Patel. I'm a urologist and the co-founder of Men's Health Clinic Manitoba, as well as a high-volume Rezum specialist. Are you interested in Rezum Water Vapor Therapy for your enlarged prostate, or BPH, benign prostatic hyperplasia? So we're just going to discuss a little bit about what Rezum is, and if you're the right candidate for it, and what to expect during and after the procedure. When it comes to an enlarged prostate, you may suffer from symptoms such as urinary frequency and urgency, incomplete emptying, or even a sensation of having hesitancy as well as a weak stream. When it comes to Rezum, it is a minimally invasive procedure where we inject steam through the urethra into the prostate, and that steam works by decreasing the size of the prostate, thereby opening the channel, allowing you to have a stronger stream and improve your bladder's ability to empty. When it comes to Rezum, the retreatment rate at 5 years is roughly 4.4%. Just like any prostate procedure, there's always a retreatment rate, and the reason for that is that the prostate does grow over time. So unfortunately, all prostate procedures do have a form of retreatment, but the Rezum procedure is quite low. Now, when it comes to the procedure itself, prior to confirming that you're eligible for the procedure, there may be a few tests that we need to do. One of these tests may include a cystoscopy or scope that goes inside the bladder to take a look at your prostate anatomy as well as your bladder. Other tests will include an ultrasound to see how big your prostate is. When it comes to these minimally invasive procedures, they do work with certain types of prostate sizes, and this is generally between 30 and 80 grams. Now, once you've been deemed eligible for the Rezum procedure, it's typically done in an outpatient setting where you'll be going home the same day. At Men's Health Clinic Manitoba, we perform the procedure under sedation to make you as comfortable as possible during the procedure. We perform the procedure by going to the urethra, injecting the steam in several locations. Now, the amount of injections really depends on the size of your prostate. After the procedure, you will need a catheter, and what that is a little plastic or silicone tube that goes inside the bladder to help drain. And the reason the catheter is so important is that during the Rezum procedure, we are injecting steam, and that can cause inflammation and swelling of the prostate. So it can actually close up the channel. So the catheter is there to make sure your bladder is emptying. After the procedure, you may be given a prescription for antibiotics for a few days, as well as pain medication to be taken as needed. Now, it's not uncommon to have blood in the urine after the Rezum procedure, or even around the catheter, and it can be quite alarming. Fortunately, as long as the catheter is draining, there's really not much that needs to be done for that. However, if you have any concerns, always important to call the healthcare professional that did the procedure. Once that catheter comes out, you may experience some urinary frequency and urgency, and the reason for that is that the prostate still needs a little bit of time to open up. So I typically tell patients they may not be my biggest friend once the catheter comes out, but that will generally improve at about 3 to 4 weeks. And after that period, and based on a lot of the studies that have been published on Rezum, and what we see clinically is that at 4 weeks, patients start doing better than they were before surgery, and that can gradually improve up until the 12-week mark, where they're going to see the biggest benefit of the Rezum procedure. And that's typically what they'll see for several years after the procedure. To learn more about Rezum Water Vapor Therapy, to see if you're eligible for it, or if you want to just learn more about BPH treatments, visit our website, check out our YouTube channel, as well as our other videos.